Good morning, everyone. I hope that everyone is well. I thank you for coming out today. My name is Marilyn Fraser. I'm the CEO of the Arthur Ashe Institute for Urban Health, and I've had the pleasure of being the CEO now for about 9 years, but I've been at the Institute for some time. And so I would like to welcome you on behalf of the board of the Arthur Ashe Institute, as well as of our staff members. I would like to welcome you for being here on our 33rd anniversary. So we deserve a clap for that. We deserve cheers for 33 years. So 33 years ago, Arthur Ashe envisioned the Arthur Ashe Institute for Urban Health, and he was intentional about having the institute here at SUNY Downstate. And he developed the institute. The institute was actually created in the Division of Medical Ethics and Humanities. And that's something that is important as we think about the world that we are living in today and the importance of just humane thinking and humanity and really thinking about those things. But when Arthur founded the Institute, he had a vision about 4 different pillars. One of it was reaching community members, going out into the community, doing community education, and we fulfill that through our community engagement and research work at the Institute. So we go out into non-traditional settings, we call them, that are not as non-traditional anymore. You'll see us in beauty salons and barbershops. We go out into faith-based institutions as well. The second pillar was to increase people of color in the health professions. So there was a diversity pillar. And we do that through our Health Science Academy program, and that's a pathway program for students that are interested in the health professions. And so they come to the Institute. We started that as a 10th through 12th grade program. Students come to the Institute, they're thinking about just nursing and medicine usually as the health professions, but they come and they get exposed to a whole host of different things. So they can think about public health, they can think about research, they can think about occupational therapy, physical therapy, and other things. And so we've decided to move earlier in the pipeline or the pathway, so to speak, and we have a 9th grade bridge program, and then we have a program for middle school students where we go out into middle schools and students get to be exposed to health professions. And then the third pillar is our collaborations, having strategic partnerships, and we do that through our community-based partnerships. We partner with academic institutions, we partner with policymakers, and then the fourth pillar is to inform policy. So although we may do all of this work, informing policy is important to the work that we're doing to make sure that there are systemic changes and that systems are renewed and revived and changed and dismantled and so forth. One of the things I always like to quote something from Arthur Ashe, and one of the quotes I think is so prominent and so pertinent to the world that we're living in is the one in which he says, "I know I could never forgive myself if I elected to live without humane purpose, without trying to help the poor and unfortunate, without recognizing that perhaps the purest joy in life comes from trying to help others." And so that's what we want to do, make sure that we are helping others. So years ago, we envisioned mental health as something that we really wanted to address in our communities. And we know that our environment affects us and affects who we are and the things that we do. And so we decided to create a mental health program and integrate mental health in all the other programs that we were doing, because we know that people do not live in a bubble. They live in reality with different things, environmental issues, stresses, and so forth. And when we think about health, health is just not the absence of disease, as the old World Health Organization definition says. It's not just a mere absence of disease. We need to pay attention to psychosocial issues, social and spiritual issues. So we decided to create our mental health beyond the stigma program. And so today, what you'll get a chance to hear about that program, you'll get a chance to hear about some of the work that we have done in that program. Then you'll get a chance to hear from our keynote speaker, because he's going to talk about the barriers that we face and the things that we need to dismantle and how do we address mental well-being within communities, especially communities of color, and those nuances that take place within our communities. So then after he speaks about that, then you'll get to be part of a discussion, a facilitated discussion where you're able to ask the psychiatrists questions. And this is so that we demystify psychiatry. Oftentimes when people think about psychiatrists, they may have images that are conjured up that are not relevant to it. And so today we want to talk about that and really break down some of that stigma and the barriers affiliated with that. And then after we do that, one of the things that we want to really talk about is resources. So you've heard about all the issues that are happening in mental health. You've heard from psychiatrists, and then we want to provide you with resources. So we'll have a team that'll come up and share resources with you. And then we'll come back, summarize that, and we'll break for lunch, and you'll have a wonderful lunch as always. And we'll ask you to come back into the room so that you can receive instructions for later in the day where we'll have breakout sessions. And our breakout sessions today, we really want them to be interactive. We want you to, and we've listened to you from the last couple of years that you want interaction, you want to be in sessions where you can talk, where you can ask questions, and where you're able to do certain things. So they're hands-on sessions, and they're fun. You know, sometimes as we get older, we forget to play and we forget what fun is like, but we need to go back to that at times and just remember that. So that is what the day is going to be like. And so at the end of the day, Humberto Brown, who is one of our staff members, he's going to come and he's going to wrap it up for you. But before we get started officially, well, I did the official start, but before we get into the other things that you're here for, we want to have a grounding exercise. So I'll call on Stacey Wright. She's a licensed clinical social worker, and Stacey has worked with the Institute for many years. And I had the pleasure of, I don't know, spending hours one day in my living room going through what a symposium should be like and all the different parts of it. So I'm asking Stacey to come on right now, and we'll start off with a grounding exercise. Thank you so much.
Good morning, everyone. To mark our transition into this space, I just want to invite you all to please join us in a moment to honor our breath together. So when I first started working in the space of social justice and mental health, I was reading Emergent Strategy by Adrienne Marie Brown, and I love this quote. And so it says, "Here you are in the cycle between the past and the future, choosing to spend your miraculous time in the exploration of how humans, especially those seeking to grow liberation and justice, can learn from the world around us, how to best collaborate and how best to shape change." So with that quote, I want us to take breaths together. So I'm going to read a statement, and I want you to take a breath with me. So just to get started, I just want everyone to get comfortable in your seat. If you can, make sure that your spine is supported and put your feet on the ground. And really just feel your feet and where your body is right now. If you feel comfortable, close your eyes. If not, try to find a space where you can focus. Just focus your attention there for the next couple of minutes. And with me, before we start, I just want you to take a deep breath. So into the belly, put your hand on your belly if you can, and a hand on your heart, and take a deep breath and push the belly out as far as you can as you fill it with breath. So inhale, fill the belly with air. And exhale through the mouth and let it go flat. Think of a pancake. One more time, deep inhale. Fill the belly like a balloon. Exhale. Release all the air from the balloon. Last time, deep inhale. And exhale. Now, without opening your eyes and staying with me, I want you to take a breath for our ancestors, for those that have gone before us. Deep inhale and exhale. I want you to take a breath for the land that we're on and those that it was stolen from. Deep inhale and exhale. I want you to take a deep breath for this precious moment that cannot be recreated. Deep inhale and exhale. A breath for all the days you've had so far and for all that you have overcome. Deep inhale and exhale. A breath for this work that we will do together today. Deep inhale and exhale. And now, one breath for all the good that lies ahead of us. Deep inhale and exhale. Thank you all for pausing with me as we enter this space. I'll turn it over to Kenya Kirkman, who will take you on a journey through the work that we've been doing for these past few years.
Thanks, Stacey.